What is the link between pacifiers and ear infections in children? Have you ever wondered if that little pacifier your child loves could be connected to ear infections? It turns out there is some scientific evidence suggesting a link. When babies suck on pacifiers, it can influence how their ear structures work. Specifically, it affects the eustachian tubes, which are tiny passages that connect the middle ear to the back of the throat. These tubes help drain fluid and equalize pressure in the ear. Continuous sucking on a pacifier might cause these tubes to become abnormally open or not work properly. When that happens, bacteria and viruses from the nose and throat can travel into the middle ear more easily. This can lead to inflammation and infection, which is what we call otitis media, or middle ear infection. Research shows that children who frequently use pacifiers are more likely to develop ear infections than those who do not. For example, one study found that about 36% of infants using pacifiers had ear infections, compared to only 23% of infants who did not use them. Other studies have confirmed that children with a pacifier habit tend to have more episodes of ear infections. Additionally, pacifiers can sometimes become contaminated with germs like bacteria and fungi. While some types of pacifiers, like those made of latex, may harbor more microorganisms, the direct link between pacifier contamination and ear infections is less clear. The risk of ear infections seems to increase the longer and more often a child uses a pacifier, especially after the age of 6 to 10 months. Limiting pacifier use during this period, or reducing its use altogether, might help lower the chances of recurrent ear infections. It's also important to remember that other factors, such as exposure to respiratory infections at daycare or not breastfeeding, can influence the risk of ear infections. In summary, pacifiers can contribute to ear infections by affecting how the eustachian tubes function and possibly by introducing germs into the mouth. If your child has frequent ear infections, talking with a healthcare provider about reducing pacifier use could be helpful. Remember, pacifiers do have soothing benefits too, so balancing their use with other preventive measures like good nasal hygiene and breastfeeding can make a difference. Always consult a healthcare professional for personalized advice, as each child's situation is unique.